talk through just a couple of the components related to curriculum design. And then I want you to spend some time doing a self-assessment of where you are with all of these concepts. And then you want to identify a very solid plan for yourself to close those gaps. As we look at the developing contemporary nursing curricula, there are a few concepts that I want to point out. First, as a nurse educator, you want to consider as many concepts as you possibly can that may influence the nursing curriculum. Some examples include patient safety, coordination of care, self-management, and health literacy. These are all important concepts that we want to make sure our nurses are competent in as they practice in the clinical setting. We want to have an emphasis on the burden of health problems on patients and families, strategies to decrease the gap between practice and evidence-based practices. So we want to ensure that our policies and procedures are aligned with the strongest evidence in the literature about what nursing practices should be. A way that we're able to do that is to role model that and also to partner with our healthcare partners to ensure that there is consistency between what is being taught in the classroom and what our nursing students are visually seeing for themselves in the clinical area to ensure there is strong alignment. And then strategies to generalize across populations as we think about the health disparities that we're still seeing happening as published in our Healthy People 2020 edition, as well as what we're seeing on the front lines every day. We know that continues to be a challenge. So these are all some of the key components when you think about developing your nursing curricula that you want to be mindful of. We are utilizing our Teaching and Nursing as a reference by Billings and Halstead, the 6th edition. This is where you're going to find more detailed information about some of these key concepts. And then as it relates to the detailed test blueprint, when we talk about curriculum design, exactly which elements are we talking about? Well, some of those will include institutional philosophy and mission. So how does it align? How does the curriculum in the nursing program align with what the institution's goals are? And then our community and societal needs. That's a big stakeholder for us in the nursing program, is just making sure that we are equipping our nursing students with the most solid knowledge they can have to practice safely. And then aligning with that is going to be our current nursing and healthcare trends, looking at our nursing principles, standards, theory, and research, and then use of technology. We know that in a pandemic and in our challenging situations for healthcare, for the healthcare setting and clinical placements, it's been a little bit of a challenge. So we want to make sure that our curriculum reflects educating our nursing students about the use of technology with electronic health record and ensuring that nursing students are ready for the clinical setting, and introducing them to technology in a nursing program is a fantastic way to equip them with that extra knowledge.